Hi, I'm Kate Ferguson for Real Health. Today the topic is culinary medicine and cardiovascular health. Today we have with us Emmitt Smith. He's an NFL record holder and running back. But I think most people know him best as the season 3 winner of Dancing with the Stars. Welcome, Emmitt. Also with us is Emmitt's wife, Pat Smith, who is a former Miss Virginia beauty queen and media personality. And Dr. John Puma, author of the book Chef MD's Big Book of Culinary Medicine. He is a board-certified specialist in internal medicine, and you can also see him on the Lifetime TV series Health Corner, where he is the host of What's Cooking with Chef MD. Welcome to all of you.
Thanks so much, Kate.
Okay, Dr. Puma, I'll direct the first question to you. You're a pioneer in this exciting field of culinary medicine. Now, talk to us about this concept. We're very familiar with chicken soup for colds. Is this the kind of thing we're talking about with culinary medicine?
Kate, it's the beginning of the kind of thing. Culinary medicine is the art of cooking blended with the science of medicine to give you restaurant quality food that helps to prevent disease and in some cases even treat disease. It's easy, it's quick, it's fun, and it's something you can do in your own kitchen.
Okay, now the statistics say that over 80 million Americans have some type of cardiovascular disease. What can a dietary program do to address these conditions?
A dietary program to prevent cardiovascular disease is essential and the most important first step in taking steps to prevent disease. Now, Emmitt and Pat have created a game plan for heart health that you can watch on mendedhearts.org and download to ask the right questions of your doctor, specifically about diet, about fitness, about your numbers, and about alleviating stress. Diet is the centerpiece, and what I like to do is give people the right foods to eat. Not just fruits and vegetables and nuts and whole grains, which we all know about, but fish. Fish really ought to be in the center of the plate because it's such a powerful superfood. It's actually been made into a prescription medicine with prescription-strength omega-3 fatty acids in a medicine called Lovesa, which treats very high triglyceride levels. And triglycerides are an artery-clogging fat in the blood that not many people have heard of, but it's an important risk factor for heart disease that you can actually control with what you eat.
Okay, now, Emmitt and Pat, you have this husband and wife approach to maintaining a healthy heart. Could you tell us a little bit about that?
Well, we have a family history of heart disease, and we partnered in with mendedhearts.org to bring awareness to the program and the game plan of health. And if you have high blood pressure, high cholesterol, or even are diabetic, you are at risk for high triglycerides. And going to mendedhearts.org and downloading that game plan for a healthy heart, you will be able to go to your doctor and ask some questions and check off some of those things because we're providing information to help you ask the right questions. So with our family history, we have taken what I would call a leadership role for our
Actually,
health.
I became the head coach in our family. I took charge just because, you know, with what Emmitt told you about our parents, we both suffered through that experience with them, and we're determined to get the word out to people that you have to have a game plan. You've got to eat right, as Dr. Puma said. You have to work out, and you have to go to your doctor on a regular basis. So I have kind of taken the leadership in that role, making sure that as a family that we stay focused on trying to have a healthy heart and getting the word out to other people.
You know, small changes like Emmitt and Pat have made really make a big difference in your heart health. Just learning to shop around the perimeter of the store. Start with fruits and vegetables first, go on to the fish, go on to the whole grains, instead of those middle aisles where, gee, who knows what's in those processed foods that are strange shapes anyway. And cook once a week. Not everybody can cook every day. Not everybody likes to cook or even has the skills. But if you cook just once a week, you can actually make enough meals in almost the same time as you make for, say, just 4. You can make 8 or even 12 meals in just 10 or 20% more time. Cooking in quantity is one of the secrets to losing weight and keeping it off and keeping your heart healthy.
Okay,